India has recorded deaths of 2 people, one each in Karnataka and Haryana due to the influenza, a subtype H3N2 virus, the government said on Friday. It added that around 90 cases of this virus have been reported across the country. The statement by the authorities has come just days after the Indian Council of Medical Research announced that the recent uptick in the cases of intense cough lasting for over a week, coupled with fever in several parts of India, can be linked to the influenza A subtype H3N2 virus. To talk about this is Amesh Adalja, senior scholar, Johns Hopkins Center for Health Security and Infectious Disease physician. Amesh is joining us from New York. Amesh, welcome to the program and thank you very much for joining us at this hour. What can you tell us about this influenza virus? Any reason to worry?
This is the ordinary influenza virus that had really been on hiatus during the COVID-19 pandemic. And this is influenza season in the Northern Hemisphere. India is in the Northern Hemisphere, and you're having the usual influenza season. So this is to be expected. And those 90 cases that have been reported in India are likely just the tip of the iceberg. There's many, many cases of influenza that are not diagnosed and therefore not reported. This is the usual flu season in the United States. We went through our flu season a couple of months ago, and 18,000 people were estimated to have died from influenza. So this is what we would expect. I think people have just forgotten about influenza because of COVID-19.
Any reason to worry?
No, I don't think there's any reason to worry, but I think it's important to remember that you're in flu season, so it's important for people to get vaccinated against influenza. It's important for people to get treatment for influenza, and it's important, especially if you're high risk, to seek medical attention if you develop fever, chills, shortness of breath.
Amesh, I have to admit here that I am also currently under the weather. Its symptoms are similar to that of any other flu. They include cough, fever, body ache and headache and sore throat, a runny or stuffy nose and extreme fatigue. Nausea, vomiting and diarrhea have been seen in very few cases, but precaution is the same as COVID-19. Why so?
Well, I think that, first of all, the symptoms of influenza and COVID-19 are pretty much the same. You cannot distinguish the two. So you do need to isolate, you do need to be careful about spreading, whether you're spreading influenza or whether you're spreading COVID-19. The treatments are different, but they're both respiratory viruses and cause very similar respiratory symptoms. And I think it's important that we treat influenza and take it seriously. And I think that's why, while there's no need for panic, it's important for health authorities to be aware of influenza spreading and to make sure that vaccines and antivirals for influenza are available and that people are aware that this is something that is increasing in your country.
There was a concern earlier this month of the H5N1 or the avian flu, making a comeback in the country. How different is H5N1 and now H3N2?
H3N2 is a seasonal flu virus. It's been with us since the 1960s, and it infects people every year. H5N1 is a completely different type of virus. It's not a human influenza virus. It's an avian influenza virus. And right now, the world is seeing a lot of H5N1 cases in birds, in waterfowl, in chickens, in turkeys, in poultry. And some infections of mammals like foxes and marine mammals. However, H5N1 is not something that can ordinarily infect humans. There's been very few cases of this clade of H5N1 causing human disease, even though there are millions and millions of cases probably in the avian species. So these are two totally different issues. They're both influenza viruses, but H3N2 is a seasonal influenza virus that we deal with year in and year out. It's just sort of been on hold during COVID-19 because the social distancing made it much more difficult to spread.
Amesh, which age group is more vulnerable? And as you answer that, maybe you can tell us about the issue to do with comorbidities.
When it comes to influenza, those that are at the highest risk are the very young, the very old, as well as pregnant women and those that are immunocompromised. And comorbidities do make a difference. Obesity, diabetes, HIV, heart disease, lung disease, all of those are going to make influenza more severe.
All right. So how do we prevent it from, spreading?
Well, influenza is going to spread. I think we know that this is a virus that is very adept at spreading through human populations. And our goal is to decrease the amount of hospitalization, the amount of severe disease, the amount of death that occurs from influenza. And that really means making sure vaccination rates are optimal. In the United States, we have a universal vaccination program where everybody from above the age of 6 months of age is eligible to be vaccinated for influenza. And we use special vaccines for high-risk populations like the elderly. That's the cornerstone of prevention of influenza, is vaccination. The other aspect of this is making sure those high-risk people are able to get antivirals like the drug Tamiflu if necessary, and that can decrease symptoms and decrease spread as well. Remember also that if you're sick with a cough, fever, that you should not be around other people. You should be isolating, whether you're isolating for COVID-19 or isolating for influenza. It doesn't matter. You shouldn't be around people if you are sick.
Amesh, as a physician, what advice do you have for health experts, for example, in this country and also around the world?
Well, I think it's important to take influenza seriously and use all the tools that we have. We have vaccines, we have antivirals, we have tests for flu. It's important to be aware that influenza is a virus that's been with the human species for thousands of years. It's going to be with us for thousands of years. And I think we have to get better post-COVID at dealing with respiratory viruses like influenza.
All right, we'll have to end this discussion there. Amesh Adalja is a senior scholar at Johns Hopkins Center for Health Security and Infectious Disease physician. Amesh, thank you very much for talking to WION today.
Thank you.
WION is now available in your country. Download the app now and get all the news on the move.